First, let me thank my husband, Kevin, whose unfailing love and support give me the strength to fight back. At this time, 6 years ago, I was in my 3rd month of chemotherapy. I had already undergone 1 surgery for breast cancer, and ultimately I would have 2 more before after I finished my 6 months of chemo. Then I had my last 2 surgeries. So I was really learning what it takes to fight cancer. I came to the Wrightstown Relay for Life that year in June 2003. I found my luminary on the track. Some of them were set up before the relay began. And I found it, and I left the track before the opening ceremony even started. I was in tears. I was so overwhelmed. But I had a glimpse of the power of relay and of the American Cancer Society. And when I was ready, I decided to make something positive come out of my cancer experience. I decided I would fight back. My personal fight goes on as I continue to take medication to reduce my risk of a recurrence, and as I strive to eat a healthier diet and exercise more consistently. These personal commitments to lifestyle changes and to regular screenings and follow-ups are important steps in fighting back, and they are things we should each consider doing. But to affect the larger community, to make an impact that reaches beyond the personal, we need to raise our voices for public policies that promote health, for access to quality health care, and for adequate funding for cancer research. I became an active volunteer with the American Cancer Society and with its advocacy affiliate, the American Cancer Society Cancer Action Network, known as ACS-CAN. This is a very real, very necessary, and very rewarding way to fight back. As a volunteer, I've had the opportunity to meet with our legislators, both here in Wisconsin and in Washington, D.C., to show them the face of cancer and to help them understand why our legislative priorities are so vital. And working with many other volunteers, I've secured their support for a number of our issues. But maybe you don't want to travel to Madison or to Washington. Maybe you want to start with something a little less time-consuming. ACS-CAN is still for you. The easiest way to get involved is to simply join ACS-CAN. Your membership dues support the advocacy work that we do here in Wisconsin and on a national stage. Maybe you're ready to do a bit more. You can join our Action Alert Network. ACS-CAN will contact you when our legislators need to hear from us. Given the information you need to email or call your legislator's office, it's simple. You give your name, your address, the message, and say thank you. Research has shown that it often takes only 3 personal phone calls from constituents to influence a legislator. Only 3. What an easy, effective way to fight back. Some people think that talking to their legislators or to the legislative staff is difficult or even intimidating. Trust me, it's not. ACS staff and other volunteers will support you, make sure you have all the information you need, and help arrange those meetings. And usually there's a small group at the meeting, and really all you have to do is tell why that cancer-related issue is important to you. It's a lot like telling people why you relay. So what effect does any of this have? Well, in 2006, I attended Celebration on the Hill, sponsored by ACS and ACS-CAN in Washington, D.C. Less than 2 months before I went, my mom was diagnosed with cancer. The event fell in between her chemo treatments, so I went to fight back on her behalf as well as my own, and to represent everyone affected by cancer. I was with thousands of other volunteers from across the country, each of us with our own reasons to fight back. We had a relay-like event on the National Mall, and we met with our legislators. Many of them were persuaded to sign the Congressional Cancer Promise, a commitment on their part to elevate prevention, increase research funding, and expand access to care. Just a few weeks after I came home, my mom died from cancer. And every year since then, I've gone back to Washington to remind our legislators of the promise they made and to secure their support to fund research and other important cancer-related programs. You all know that Relay for Life raises thousands of dollars for the American Cancer Society. and some of that money funds groundbreaking research. But the largest funding source by far for cancer research is the U.S. government. We can make sure that the money goes into the priorities we know are important for screening, treatment, prevention, and ultimately to find a cure. On a state level, we recently celebrated the successful passage and signing of the Smoke-Free Wisconsin bill, eliminating exposure to secondhand smoke in work sites and public places. This bill has been a priority for ACS-CAN and for ACS for years, and its passage is a huge victory for our grassroots volunteers. I was one of many volunteers who met with legislators, attended and testified at public hearings, wrote letters to the editor and to my legislators, and called their offices. Colorectal cancer screening is a priority at both the national and state levels for ACS-CAN. And you probably know people who struggle to pay for their screenings or their treatments or their prescriptions. Meaningful health care reform to include health insurance coverage that is adequate, available, affordable, and administratively simple is another one of our priorities. We know cancer touches everyone in some way. All of you have a Fight Back flag, or at least most of you do. Hold them up for a sec. Look around. Those flags represent the people in Brown County who will be diagnosed with cancer just this year. 1 in 10. 1 in 10 people in Brown County will be diagnosed this year. Isn't it time we fight back? So many of us have lost family or friends to cancer. We need to fight back because they no longer can. Isn't it time we raise our voices with the power of ACS and ACS-CAN behind us? Relay for Life shows us that we can each make a difference. I am asking you to take that next step and fight back against cancer for yourself, your loved ones, and for our communities. Thank you.
Thank you, Kathi, for taking the time to come here tonight and encourage our community to fight back against cancer.